Okay, we are recording now. I apologize.
Okay, so we missed the intro, but I think that'll be. So do you see the, sorry, that was distracting. This little guy, if you can see my cursor, maybe I can get a pointer. Here we go. There, this little guy is a barberpole worm. So they are in there, they're latching on and they're drinking the blood. They like make a little hole, and when it bleeds, they suck up the blood. So we're going to look at, first we're going to talk about gastrointestinal parasites, the ones that are mostly in the stomach or the intestines. And on this chart circled here are all the eggs that you would look for if you were doing a fecal sample. You can see how similar these all look. So it's very hard to tell them apart in a fecal sample without special dyeing, knowing how to dye them. So the one we're going to talk about first is Homunculus contortus. That's this one that's kind of gray there in the middle, or on the left, sorry. And that's the one we were just looking at. So we'll take a look at that. The good news is most of these intestinal parasites have a very direct life cycle. So the eggs hatch in the manure of an infected sheep or goat, then the larva goes through a few molts. This is out on your pasture. And you can't see them, but they're out there. And then they become infective larvae, which are then eaten by another sheep or goat. And then inside the sheep or goat, those larvae mature, and then they breed and produce eggs. So they're breeding and producing eggs in the sheep or goat, and then they poop them out on the pasture. They hatch, they molt, and they get eaten again. So it's there's nothing in between, no other species that they have to go through. The eggs and the larvae can tolerate cold temperatures and some even overwinter on the pasture. And it tends to be a pasture and barnyard problem, especially if the pasture is small and damp, which these days, even with a big pasture with all the moisture we've had, it's a big challenge. They don't generally pick up many larvae in the barn because they aren't normally eating off the ground, for one thing, and the ammonia gas from the bedding or the bedded pack discourages their survival. And so you want your animals eating out of a feeder if possible. I will say that when you bring animals into the barn, like when we wean our lambs and they already have a fairly high egg count, it does take a while for that to go down. It doesn't just, they don't all disappear. In other words, they just stop getting reinfected, which is a good thing. So here's our barberpole worm. And this is the one right here. This is a barberpole in case you're too young to even know what a barberpole is. So it's like a candy cane, right? It's striped. That's the blood in there that you can see. And this is the tip, and it has like a little sharp spot there that bites into the abomasum lining. And then when they bleed, they suck up the blood. And you wouldn't think a little worm could make that much difference, but there's so many of them that can actually take a lot of the blood. So it was originally a parasite of warm climates, but it's spread to the Northeast. I don't know if that's a result of climate change or just us moving our animals around. And short generation time, so it reproduces quickly, makes a lot of eggs, and they can consume 0.05 mLs of blood per day, which again doesn't sound like much till you multiply that times 10,000 or 100,000, and you realize that that's a lot of blood and could really make an animal feel very weak and even die. So they can infest and kill a host in 4 weeks. And the hard part is you probably won't know it's happening when it's happening. So we'll talk about that right now.
Betsy?
Yes?
If I can point out one thing, that's a female worm there. The male worm is all red. The female worm is red and white because the white there is her ovaries.
In case you're looking at barberpole worms and you want to sort them by sex. So clinical signs of the barber worm infection are not diarrhea, right? So therefore, it's not that easy to tell that they have an infection, and they can be going along looking just fine, and they're becoming very anemic. So how are we going to figure that out? One way is to look at their mucous membranes, which you can see a person pulling down the lower eyelid and looking, and that one's white like a piece of paper. That's very bad. Should be nice and pink, almost red in there. So that's one way to tell, and that's the FAMACHA system, which we'll talk more about later in the talk. And sometimes they develop bottle jaw. So if you look at the hair lamb on the bottom, it's got fluid that's accumulated under the chin, and that little pouch is all soft and jiggly if you touch it. And that's because they're losing protein, and the fluid is leaking where the barberpole worms are sucking away in the abomasum. So if you see a bottle jaw or pale mucous membranes, then you're likely to have a barberpole infection. And the problem is the animal may not really show that they're not feeling well, and they may not get bottle jaw. So you need to have a way to check them, which is the purpose of the FAMACHA. So we'll talk more about that later, but homuncus is one of the few worms that is likely to actually kill an animal. So you want to be on top of that one. We'll talk about other ways to control it as well. The brown stomach worm, that used to be considered the most serious parasite of the sheep in cooler climates before the homuncus came along. And this one develops in the gastric glands of the stomach, or what we call the true stomach in a ruminant, or the abomasum, and destroys the glands as they grow. So because of that, they're not going to digest their food correctly, and that makes their nutrient utilization and absorption not so hot. And so they might not look as good. So they usually have diarrhea. They don't eat as well. They have some weight loss. Their hair coat might look rough, that sort of thing. But they do tend to have diarrhea in this case. And there's other strongyles. I don't know if, so all of these worms disrupt digestion and absorption of nutrients by damaging those gastric glands in the abomasum, or by damaging the lining of the abomasum or the small intestines. But the clinical signs are fairly obvious, unlike the barberpole worm. They have diarrhea, they have weight loss, and the rough hair coat we were just talking about. And so there's a couple different ones listed there, which I won't try to murder their names, but you can see their eggs over here on the lower corner all look very similar. And there's the homuncus contortus barberpole worm. And here's the others. So it's a little tricky to tell from the fecal sample what you got. And there's one other one, nematoderus, that's a larger egg, which is a little easier to recognize. Don't see that very often, but otherwise they're pretty indistinguishable. Did you want to say something, Tot?
Well, I was going to say that it isn't that they're hard to tell apart, it's that they're impossible to tell apart. Chart, the only reason they look different is because a different stain happened to be used on them. But in order to actually identify these worms, a parasitologist actually has to culture them, or there's a few other things we can do. Some of them will fluoresce in certain kinds of stain, and some of them won't. But basically, you can't really tell those eggs apart.
So you can get an egg count, but you don't really know which it is. You have to use other signs to tell what it is.
Correct.
So there's strongyloides, which there's been some of that showing up this year. And it's also sometimes called the threadworm or the pinworm, but it's not like the pinworms that your kids might have had when they were young, or not the cat and dog species that infects people. And they have a complicated life cycle, and they're pretty well evolved. They can produce sexually or asexually, and they can be ingested from the manure in the pasture or from the dam's milk if the larvae migrate to her udder. They can even get in through the skin and that little hairline right above the hoof, especially in muddy, infected pastures, like around, where you go in and out of the barn, or around the water trough, those kind of places where animals are stepping down in the mud and maybe poking themselves with a piece of gravel or something that's in the mud, and then these little critters can get in there. And they can even get in there prenatally if the larvae have migrated to the placenta. So they're pretty bad guys. They are sensitive to the cold and the dryness. But the symptoms are diarrhea, again, if there's enough damage to the internal or the intestinal mucosa. They can die, although I think that's fairly unusual because people would notice they were not feeling good first. And if their lungs are infected by the larva, they might be coughing, and they might get a secondary pneumonia as well. There is a lungworm that also causes coughing, so just be aware that they're both out there. And I haven't seen this, but it does happen, seems to happen in certain years and not others.
Yeah, Betsy, I know this year on almost all the farms I've been on, we've had strongyloides because conditions have been wet and it's been getting in through the hairline. And it's an egg that's smaller than the strongyle egg, so you can tell it apart when you look under a microscope. It's smaller than them.
I assume it's probably susceptible to about the same dewormers, though.
Yes, particularly the ivermectin family.
So we're going to talk about tapeworms. Now, tapeworms, the only thing I like about tapeworms is they're one of the few worms you can actually see in the manure. And you can see they look a lot like linguine or fettuccine. And when you see them in the worm, or you see one in the manure, they actually look like pieces of rice, and they're very white, so they stand out in the manure. And you usually see it in the lambs because it's something they sort of get an immunity to after a while. And I have lambs born in April, May, and I tend to see tapeworm in the eggs around the middle of July, occasionally earlier, but they get over it generally on their own. Occasionally you can have problems with it if they get a really severe infestation. But they live in the small intestine and they pass out through the feces. You can see them. The eggs are eaten by a pasture mite. Now, you didn't even know there were mites on your pasture probably that are eating these things, but they're out there. The egg hatches in the mite, and the mite is eaten by the sheep or goat. I've never seen a pasture mite in person, but I know they're out there, and they are in this life cycle of the tapeworms. So again, you don't usually need to treat for them, especially if you're vaccinating your lambs. But I have seen at least one farm where they were causing a problem, not the worms themselves, but we did have lambs that were dying, and I think that's not related to the worm, but to a clostridial infection related to having too many worms. So these are lungworms that are circled here. We're going to talk about lungworms, and these are larvae. You can't find their eggs in the fecal sample. Most of them are curly. These are 3 different types. I'm not sure which type I have had them at my farm, and they tend to show up later, a little bit later in the fall. Matter of fact, the ones I had really came to light on Christmas Eve, which I'm sure the vet didn't appreciate. But I had 2 ewes and a llama. I had a llama down actually with the lungworms. So let's take a look here at lungworms. They have an indirect cycle through a snail, and you're going to find that snails are really troublemakers in this whole parasite thing. They seem to be working together a lot of times. So there's some of them go through the snail, and there's one kind that is a direct life cycle. They can cause coughing and fluid in the lungs and lead to pneumonia. And I think this curly one here is what I've seen in a fecal sample before, very typical looking one. It's excreted as a larvae, not an egg. That's why you can only find the larva in the feces. And to be sure, you want to take the fecal sample right from the animal because they can have little nematodes like this in the soil. So if you're taking one up off the ground, you got to be a little careful not to confuse it with a soil nematode. But luckily, they are also killed by the same things that get stomach worms and intestinal worms. But after my little experience of having that around Christmas time, I did deworm all my sheep and goats in the fall for a year or 2 and confine them to the barn so that they wouldn't drop all the resistant worms out on the pasture. And now we know that doing all your sheep and goats at once is not a great idea. So I don't do it anymore, but that was to try to make sure I didn't have lungworm. Liver flukes. Now, there's a couple different kinds of liver flukes, and we'll talk about all the different kinds in a minute. There are some farms in the Northeast that have acute and chronic liver fluke populations, and they do require water or wet areas at least, and snails, those darn snails. You You can kill adult liver flukes with albendazole, which is also, the trade name is valbazin, or Ivermectin Plus, and it's the chlorsolon in the Ivermectin Plus that actually kills the flukes. So we'll talk about the different kinds here. And I had a really bad experience with the second one there, the deer fluke, which I'll tell you about in a minute. If they have the indirect life cycle in the snail or an ant as intermediate hosts, you have to remember that any place there's snails is not a good place to put your sheep. And I did a bad thing, and I fenced in the corner of the woods down in a wet area, trying to give the sheep some shade because they couldn't come back to the barn. And I think as a result, I exposed them to a lot of snails that were, under the woods, it stays pretty damp in the morning, or along the hedgerow, same thing. Seems like a great idea to go right up against the hedgerow, but if it holds a lot of moisture, you'll see a lot of snails there. So just a warning. The Fasciola hepatica, the common liver fluke, supposedly is not in New York, but I have talked to people whose vet feel they did have that particular fluke. The Fascioloides magna is the deer fluke, and doesn't bother the deer, but when you get them in your sheep, it's not very good at all. And we'll talk about that also. I had a very bad experience with deer flukes. And the last one down there, the lancet fluke, is really a health problem, even with heavy infestations, but it can cause your liver to be condemned at the slaughterhouse. So I think we're going to talk about each of these individually. So the hepatica, or the common liver fluke, or the sheep fluke, we used to think it wasn't east of the Mississippi, but there have been some affected animals in New York. I had a farmer to the east of me that did have lambs with flukes, and I'm not sure that they came from around here, the sheep, so it's possible they came with the sheep. It does include freshwater snails in the life cycle. It does cause acute peritonitis to the liver, because these little things, somehow, I don't know how they know where they're going, but they go around in the liver, and they even go around in the cavity, the stomach cavity as well. Not in the stomach, but in the area of the liver. And I'll show you a picture of why I say that. It often causes chronic wasting and problems afterwards, even if you get rid of them. And it can cause bottle jaw, like we were in anemia. So that's a little, we talked about that being something for the Barberpole worm, but it could also be the fluke. It tends to be around here, at least. I can't speak for everywhere, but in our climate, it tends to be, these show up later in the summer or in the fall even, which usually the Barberpole worm is earlier in the summer, usually. The magna is the deer fluke. It's definitely found in the Adirondacks, the Catskills, anywhere there's deer, I would think. It's a natural parasite of the deer. Doesn't bother them, or that we know of at least. But in sheep and goats, they're not the normal host, and it's not a good thing. So they're little and they don't actually mature, but they like to travel all around through the liver and make a big mess. So they don't mature and don't excrete eggs. So they're not passing it to each other like they might other worms, but they're doing a lot of damage. And they also tend to drag something around in there, like that's Clostridia, and that can kill your sheep really quickly. It's an acute disease. It can be fatal within 6 months. And I'll show you some pictures, then I'll tell you a story. This is the liver of a goat killed by a deer fluke. And if you know what liver looks like, it's supposed to be sort of smooth and reddish brown and solid, not all full of holes and scar tissue. I'm just going to go to the next picture for a minute. This is the liver of a sheep who died of deer flukes. And unfortunately, that's my kitchen sink and my hands, and a liver from one of my many sheep that died from the deer flukes. And you can see the black in the liver. And you can see, if you look down here, this is the part of the reticulum, and there's part of the diaphragm. Everything, when I opened these up to do a necropsy, you have to realize this is like in the middle of winter. It was like 5 degrees out. Everything was stuck together inside the sheep. So there was a lot of irritation going on by these little critters migrating around. I had to like hack it out of the other organs. So they were actually killed by novii, Clostridium novii, which is black liver disease or Black's disease, they call it sometimes. And so we had to try to kill the flukes, which is hard because they're not mature. And there aren't many things that will kill immature flukes. And we quickly gave them all a vaccine that had all the other Clostridium in them because I had only used CDT, which only has tetanus and overeating. And we did that all, it was freezing. And I had my daughter and her boyfriend who'd never been on a farm helping, but they were very good and tried to help save the sheep. And we did give them chlorcelon, Ivermectin Plus with chlorcelon, and we did give them valbazin at a dose recommended by Mary Smith from Cornell. We didn't lose any more after they were treated, thankfully. I did have some that were sick, but didn't die, that were just they would stand with like their head in the feeder, but not actually eat anything. They were just kind of very blah and they'd get skinny. I nursed most of those back to health, and they did surprisingly well after they recovered, but it was really scary there for a while. I lost like 15 out of 110 or 20 sheep over from Halloween through Christmas. And the first one we found her, I found her down below the farm, the barn a ways with her head blown up the size of a basketball. And we didn't really know what was wrong with her, but we laid her on the back of an ATV and drove her up to the barn and put her in the dark because it looked like it might be a photosensitive type reaction. And I had to, her lips, she was so swollen you couldn't really open her mouth or anything. I had to drench her with water and Gatorade, and I kept her alive, and her head unswelled and then all her skin peeled off. She looked like the zombie sheep. She had pus coming out of the middle of her eyeball on one side. And I probably would have been arrested if anybody actually saw her in the barn, but she survived, and her name is Scarface, which surprisingly, that was her name before this happened too, because she had a Harry Potter scar on her forehead. And she's still producing lambs, and she's 10 or 11 years old. She looks horrible. I can't ever send her to the sale. She'll have to be euthanized at my house probably, because she has a rat tail and only half an ear on each side, and she's pretty rough looking, but she is pretty tough. And that was actually turned out to be the first one. We didn't know what caused that, but later looking back, we know that the liver, having her liver messed up could have caused that. And then I just started finding sheep dead in the morning. I'd go in and there'd be a dead sheep in the barn, another dead sheep. And eventually we put 2 and 2 together after doing these necropsies and finding the gross livers. So now what I do is all my sheep get the 7-way Clostridial, like something like Vision 7, which is approved for sheep in the fall. And then because that doesn't have tetanus in it, I give the CDT in the spring before they lamb. And the reason you can use Covaccinate, that has everything, and it's a very good product, but it is, it's a painful shot. So it's a hard one to give over and over every year because they have to have 5 cc's, I think, the first time. And I find it easier to give them 2 cc's of the Vision 7 and 2 cc's of the CDT at different times. And that doesn't seem to get such a big reaction out of them. They don't get left with a lump on their neck or anything like that. So that's my deer fluke story. And nobody knew what it was at first, including me or the vet, but we did manage to do a little CSI and figure it out. So I'm going to go back here. So the best treatment for flukes is to prevent it, of course, and try to fence off wet areas, keep them out of the swamps, keep the deer out of your pasture. Now my guard dogs would keep the deer out. The problem is when you're doing rotational grazing, they can only keep the deer out of the pasture that your sheep are actually in. And it's hard to kill the larvae. It's harder to kill them than the adult flukes. One thing that might work is albendazole, which is valbazin, if you go to buy it in the store. And you have the dosage there. I'm not going to read that all off. And chlorcelon, which is in Ivermectin Plus. And there's your dosages for that. I would definitely work with your vet, though, if you think you have flukes, because you may have other things happening too. And then I had the same thing here, and be sure to give them the vaccine as soon as possible if you don't do that already. And I still do that at home, and at the extension farm, we've always given just the CDT with no problems, but we may be finding that when we sell our lambs to other people, that maybe it'd be important for them to have the 7-way. So we may change our whole process on that. So now we're going to talk about coccidiosis. Now, coccidiosis isn't a worm. It's actually a single-celled protozoa that damages the lining of the small intestines. And it tends to show up in calves, lambs, or kids when they're young, like at 3 weeks of age. They get it's in the adults a little bit at a low level all the time. And then when the young ones are born and they get to a certain age and they get exposed, then they can have trouble. Tatiana, we need to admit Rachel there. She's in the waiting room.
Okay, I've admitted her.
Okay, great. I just saw it come up there. I didn't want to keep going until she got back in. They tend to have a poopy butt or a mucky butt, and it's spread through the infected feces, decomposing feces in the soil or the bedding. It tends to be an inside problem where you have pens of young animals or old and young animals mixed together, or animals that are young but of different ages. So unfortunately, I can't read the top of my slides because this is in the way. Here, let me see if I can move it. High floating meeting controls. There we go. So severe coccidiosis causes many small white foci in the intestinal wall. So those are like little scar tissue places. And so absorption is impaired and it damages both the small and large intestines. So they're eating fine, but they're not getting the nutrients from what they eat. And that's a pretty bad one. Picture there. Now I got to find my little dot here. Come on. There we go. So Emiria, and they were on that little chart that we looked at up on the top left. Look like they're the same shape as the other eggs, but smaller. Kind of like a hard-boiled egg cut in half lengthwise. There's many species, but they're host specific. So you don't have to worry about your chickens being in with your lambs or something like that. They do develop immunity to each species with exposure, but you don't want to like overexpose them at first. So you want to avoid sudden exposure to large amounts of infected feces, which could happen if you're bringing things into your barn or weaning things into the barn, that sort of thing. Stress can make it worse, and young animals don't have much immunity built up yet. So older animals can have the same problem also with other worms, that they don't have as much immunity, and so they can be susceptible to coccidia as well. So orphans, when you're weaning them, when you're moving them to a new home, young mothers that are stressed, nursing new babies. And when you have too many in a small space, that's true of almost everything. It's not a great thing. So a lower density of animals helps. And coccidia is a tough one. You can never really kill it. Even when you treat it, you don't kill it. You just kind of stamp it back. And so if it's warm and moist, like the bedded pack, or wet spots of spoiled feed and that sort of thing, that permits sporulation, and it goes from eggs to infectious in 1 to 2 days. So that's pretty quick. And it can survive a long time under good conditions. So the best thing is sunlight, fresh air, low humidity, clean sanitation in your barn. You see the lamb standing in the feeder? None of our lambs do that, do they? And goats like to do that also, stand in the feeder and poop. And so it's spread around pretty easily. If one animal in the pen has it, they probably all have it to some extent. And they do build up immunity as they age, but it can also be bad enough that it's really affecting their health as well. So ideally, you'd raise your dairy kids and lambs away from the adults. If possible, you can separate the young animals by age, so you don't have them, like if you're lambing several times in the spring, some people lamb, some in May, some in June, that kind of thing. You don't want to mix those together. And luckily, when they're nursing, the milk is protective. But then when you wean them, that's a very high risk time for coccidiosis. So you want clean, dry sunlight if possible, Want to avoid some sudden exposure to feces, especially at weaning time. And a couple pictures here, animals can sit up on these benches away from the fecal matter. Of course, sometimes they like to lay under the benches just because they can. And here's some that are outside where the sun and the air are hitting the ground and hopefully killing some of the coccidia or keeping it from being very high population at least. We have in the past put decox or one of the other, I guess we usually use decox in our mineral mix and fed it to our sheep in the barn, the adults before lambing, to help get the population down in the adults before lambing. But there's a huge population in our adults, so I'm not sure whether that is really effective or not, but it might be, if you're having a problem, it might be worth trying. So conventional, if you're not organic, you can use coccidiostats as additives in the feed or maybe in the salt or the water to help prevent it. So here, this is sort of what we were talking about, especially in pregnant females starting 1 month before parturition. So month before lambing or kidding until weaning of their young, you can put this, usually we use decox these days, into their mineral or into their feed. Ours don't get much grain, so it'd be tough to put it in their feed. These are some of the different ones you may have heard of: Bovatec, Rumensin, and decox. Now, at least our feed mill prefers to use decox because it's not toxic to horses, which some of the other ones are. And so, and they make horse feed. So they'll use decox in our feed if we ask for it, but they won't put the other things in anymore. And Corid, you've seen Corid as Amprolium. Corid is the trade name, comes in a jug or also comes as a powder, and it is approved for sheep and goats. And if you read the directions on the back, it tells you how to mix it. You can either put it in the feed trough, which is a little iffy because you don't really know how much they're going to drink. You're hoping they drink what you're predicting. And you have to keep it clean. So you then have to dump the thing and start again every so often. I like to do the drench, even though you have to do it 5 days in a row. Hopefully you don't have to do like 500 of them 5 days in a row. I think in that case, you're probably going to have to go for the water. But if you have a pen of kids or lambs that you need to treat, the drench seems like the way to go. And it tells you on the package how to mix that. There are oral sulfonamides like Sulmet, Elbon, sulfaquinoxalone, which is one of those probably. But there's a veterinary feed directive now that requires a vet prescription to use them. So you may not be able to get it prescribed by your vet, but you can ask, but they can't just put it in your feed anymore for you to use. It looks like if you're milking, I didn't realize this, but if you're milking, that makes sense because they're basically an antibiotic. You can use them if you have milking animals. So Corid, there's the rate for Corid. There are instructions on the package. For 5 days, 1 ml of Corid at that rate per 8 pounds. And I mix it up and then I put it in the fridge. It keeps pretty well in the fridge. So you don't have to mix it up every single day. You can add it to the milk. I just directly drench it. Worked for me in my situation. I have a cat crawling on me here. There we go. Ideally, it helps to keep your animal healthy in general. So make sure they have enough selenium and make sure you can supplement them with electrolytes or or supplemental nutrition and help alleviate the stress. And that'll help keep the coccidia down. I have had problems with it in the past. Haven't had any problems recently, thankfully. We had it more when we lambed in the winter and we had animals inside together more than we do on pasture. We have other things on pasture, but not so much coccidia. And we're also going to talk about another worm from the deer. Thanks, deer. The deer worm or the brain worm, or you might hear it called P. tenuis. And it is a parasite of the white-tailed deer, but in small ruminants like sheep and goats, especially, and llamas and alpacas. And I didn't realize it was bad for fallow deer, but it can cause a lot of problems. It has an indirect life cycle with those darn snails and slugs in the pasture. So I swear the deer and the snails are in cahoots. So this is how it works. The deer eats the forage that contains the slime trail of a slug or snail that's infected. And the larvae migrate through the stomach wall to the peritoneal cavity. Then they get in the lumbar spinal nerves. So what I really want to know is how these little things know where they're going, but somehow they know where they're going. They reach, I know they don't have GPS, but they must have something. They reach the spinal cord in 10 days. And then once they're in there, it becomes much harder to kill them, right? Because things like ivermectin don't cross the blood-brain barrier. We don't know what'll get into the spinal cord. It's not like the stomach. And they develop in an orderly manner in the gray matter of the spinal cord. And then they return to the surface of the spinal cord at 40 days, mature and migrate to the cranium, that's the head, right, to live and reproduce. And then the eggs are laid into the blood vessels, and the eggs hatch into first stage larvae in the lungs. And then they enter the bronchial tree. They're coughed up, swallowed, and passed in the feces. So that's a pretty complicated life cycle, and it's hard to believe it works at all, but it does. And when they get into your sheep or goats, they tend to get into their spinal cord and then cause trouble there. So they're excreted in the mucus coating of the fecal pellets 90 plus days after the deer is infected. So you usually do find this happening later in the summer or in the fall, even into the winter. And they can be killed by drying or solar radiation, but they resist freezing. That's not good. The snails and slugs crawl over the deer feces, and the larvae penetrate the snail's foot, believe it or not. And they become infective in 2 to 3 months, depending on the temperature. And they persist for the life of the snail or slug. They're excreted in the slime trail into the vegetation. And I didn't know this. There's a mean of 3 larvae for each infected snail. So pretty soon we're going to be doing fecal samples on snails to see if what they have. But when they get into our sheep and goats, they get into the spinal cord and get confused because it's not a deer. Causes all kinds of nerve damage, lameness. They sort of wobble in the back end a lot of times. They might itch at a spot. I had one that scratched with her back leg, sort of weirdly for a while. We did get her stopped. And it can actually get the paralysis can get pretty bad, and they can die, or they can just become, that they can't get up, and then they can't really do very well. But they usually are bright. They want to eat. There's nothing else wrong with them, so they're pretty happy. They just can't move around. You see this black-faced sheep is pretty typical. She's like sitting with her back end down and her front end up. I had one that dragged her back leg. I've had one that I thought got smashed by the goats because she was like wobbly in the back end. It can show up in different ways. And we'll look at we do have some videos to show you what they look like. So treatment of P. tenuis. An aberrant host means a host that doesn't normally have that worm. So there were no controlled studies in sheep and goats, but Cornell has completed a 3-year study comparing 2 treatment protocols on naturally infected sheep and goats on 14 farms in Ithaca, in that area at least. And they were scored, they had like a neurological scorecard so that we could, sort of document their symptoms. And they were videotaped the first day or 2 of treatment and after treatment. Now we can all do videos on our phone. We can do these things. So we were trying to determine if ivermectin is needed in the treatment because ivermectin is not supposed to pass through the blood-brain barrier. So can it get into the spinal cord? We didn't really know. So that was the idea is there were 2 different treatments, one that included ivermectin and one that included what was a placebo for the ivermectin. So usually you treat them with some sort of anti-inflammatory like dexamethasone. And sometimes they use Banamine if it's a pregnant animal. And but remember, those do have a fairly long withdrawal. And fenbendazole or Safeguard, which is one of the dewormers we'll talk about in a little while, because that is one of the dewormers that's approved for goats. And then some of them got ivermectin and some of them got something that looked like ivermectin, but the farmer didn't know whether it was ivermectin or not. So that was the test. I'm going to show you, I hope here. Oh, come on, this worked just before. Picture of an infected sheep.
I wonder if you need to get rid of your pointer for a minute.
I could try it. Be worth a try. Yeah, and try a regular clicker, you mean?
Yeah.
Yeah, let's try. Oh, good idea, Tatiana. Okay, this is an infected sheep. See how she's sort of wobbly or weak in the back end and can't get up? And here she is. Oops, that's her again. Okay, let me stop that. I can't find my cursor. There we go. Sorry. Here she is after treatment. She's pretty good. She's still a little bit, but not bad. She can get along. I had one that recovered, but I eventually found her. She got upside down in a hole in the pasture, but couldn't get out. Wasn't strong enough or couldn't coordinate to get out again. Okay.
I think this one, the owner did end up culling just because they were moving their animals with a stock trailer from pasture to pasture, and she had trouble jumping into the stock trailer.
Right, like she could walk around and eat and function, but she wasn't quite right.
Yeah.
Oh, there's a person
some
in
of
the waiting room.
Okay. Okay.
By my cursor. Here's the infected goat.
And sometimes these animals will appear completely paralyzed, and they can, some of them will completely recover from that. Some will show some problems afterwards. And some don't respond to treatment.
It seems like the sooner you catch it, like sometimes I'm really slow to catch on because I don't have it very often. You catch it early, it seems like you have a lot better chance of getting them better.
And I think in this study, that was what we tended to find. I do know that I've had ones that just immediately when they got it, went completely paralyzed, and we treated them right away and they came out of it very quickly. So I think a lot of it has to do with how quickly you start treatment. Even if they had really suddenly.
Before we start this, do you want to tell what the results of the study were?
Oh, sure. Yeah, I didn't realize I didn't have it. Yeah, so what we found in the study was that if we had many animals that recovered that did not get the ivermectin, but when we asked the farmers, if they wanted to give the animal something more after the 5 days of treatment, animals that had not gotten the ivermectin, the farmers were more likely to say they wanted to give them something more. And in that case, they usually gave them ivermectin since they knew they knew that they may not have gotten the ivermectin. So because of that, even though the recovery rates seemed pretty similar between the two groups, we ended up having to say that there might be a slight chance that the ivermectin helps. It might just be that it makes the safeguard a little more powerful, that it doesn't pass through the blood-brain membrane, but it just poisons the worm a little bit more. The fact that you have, are giving it along with the safeguard. So our recommendation ended up being that if you weren't going to slaughter the animal, because a big disadvantage of the ivermectin is that 94-day withdrawal period when you give it for the 5 days. So
is that injectable?
Yes, it was injectable, but I think it was the same if it was given orally. And I know for treating deerworm, I used to give it orally because I didn't know you were supposed to, in that case, use it as an injectable. But for the study, we gave it as an injectable. So we ended up recommending that if it was a pet animal or an animal that you knew you wasn't gonna end up in the slaughter chain, so that 94-day period didn't matter to you, then go ahead and give it both things, because the ivermectin for 5 days doesn't add much to the cost of the treatment. But otherwise, if it is an animal that if it doesn't recover, you're going to put into the food chain, or that may someday, fairly soon before 94 days are up, go into the food chain, then we recommended not giving the ivermectin. because chances were it doesn't really help at all.
Okay, that's good.
But it's good to talk to your vet about it. I know, like in the case of my vets, this vet service I use, they don't reduce the amount of dexamethasone that's given after the first 3 days. They keep it up. At the study at Cornell, we did drop it some after the first 3 days. We gave it at half as much. And that's just because the longer you give a steroid like that, the more chance that the animal might pick up a secondary bacteria infection, you know, that their immune system might be a little compromised.
Okay, now.
And I
Go
just
ahead.
I just want to say is on that second animal, she did semi-recover from the deerworm, but and we didn't color for, I think she was pregnant at the time, and we let her go through 2 more pregnancies after that. And at each pregnancy, she would sort of go down a little, which some people go, oh, they're reinfected. But instead, it was just that the nerve damage would catch up to her when she was in heavy pregnancy. And then after the 3rd pregnancy, we went, okay, it's just going to get worse and worse. It's time to color, you know. And so at that point, we colored her.
Right, so you can treat it, but often I found that too, that they're not totally recovered.
Actually, I think I had 4 or 5 animals at my farm that ended up being on the study, because those happened to be bad deerworm years for us, coincidentally. And I was also trying to get animals a little infected, so I was leaving them near our woody areas for long. But out of those animals, I think 3 of them completely recovered, and really only 2 were like her, where you could tell afterwards. So
well,
really,
that's good.
And a lot of it has to do, I think, with how soon you can start treatment. And the goats seem to respond to treatment better than the sheep did. But I think that may have just been coincidental.
So like I said, the problem with me is I don't think of that at first when I see one limping a little or dragging a foot or something. I'm like, what is wrong with her? Did she step in a hole? Or you have to, you have to remember all the possibilities. And like you say, treat them early if you can. Okay, now we've given you the life cycles of umpteen different worms and other parasites, and we're going to talk about what you can do about it. But I'm going to give you like a 3-minute break so you can all go get a drink of water, stretch for a minute, use the bathroom, pet the dog, whatever you need to do. And we'll be back here like 2-3 minutes. Just give us a quick break to stretch for a minute, because I know it's hard to just sit and stare at the Zoom all the time. I feel like I should play some kind of music.
Yeah, I actually thought you were going to delay the break till the switch between us, and then they could be leaving while I was.
Yeah, they could do that too.
Nah, we've done this already. It'll just be a little longer stretch for the next one.
Well, I'm going to keep this. This is a short break. This is like a 2 or 3 minute break.
Yep. No, I'm just saying they're going to be sitting for a while longer now, because it wasn't an hour yet.
Okay, I can get the cat off me for a minute. I'm going to mute for a second.
Oh, should I be stopping the recording for a second, or probably not?
You can leave the recording going. It's better if it's all on one recording.
Okay, good.
I'm going to get started here in about 1 minute.
Olivia had a comment in the chat about how she experienced it in an alpaca.
Oh, yeah. Julie's asking about the dosage in the trials for the safeguard and the ivermectin. And was that on the slide? I can go back a couple of slides and look quick.
I believe it, well, look back and see. Yeah, I don't remember.
I can't remember if it's on there. If not, there's a fact sheet at your website, which I'm going to send out on the, oops, I have to take my chat down because I can't see anything with the chat up. Let's see here. I'm working my way back. Getting a slow response on the clicker here. Come on. Is it here? Yeah. It's not per 100 pounds, but it's micrograms per kilogram.
Right.
That works out to in real life, like those of us that don't do kilograms and micrograms. And
If you, I mean, it would be about half that. So,
okay.
you know, but it is in that fact sheet. I believe it's given.
I think so too.
There's also, if they go to the page in the Cornell Small Ruminant Research website, if they go to the earworm page there, there's a letter to the farmers that has the table that we use, that has it in line.
Oh yeah, right. I remember that.
I can send you an attachment. That's that table, and then you could let people have that table.
Yeah, I can also just I'll put the link to both places in there in the follow-up with the recording, because I have a bunch of, we're going to have a couple charts of the worms and a couple of charts of the dewormers and some things like that. That'll all be on the follow-up email that has the recording link, which will probably be tomorrow, because I think by the time we finish tonight, I won't be able to get it all together. Okay, hopefully everybody's back. And we're going to start with the Know Your Weapons. And we're going to talk about those great dewormers that you can buy at the feed store or maybe have to send for in the mail. And we're also going to talk about pasture management, which is really important. And also some of the things coming up, how to deworm only the sheep that need it, and genetic selection, the immune system, nutrition. There's lots of different ways you can fight these little critters. So I'm going to talk about the chemical dewormers, and then Tatiana's going to tackle the rest of it. So we have some chemical dewormers. I will say that they're not necessarily easy to find at your local feed store. You may want to order them from Premier or Jeffers or PBS, or some of those other livestock supply places, because at least in our local stores, they only have one kind, and that doesn't necessarily one that works. So you need to maybe keep a few on hand of different types, which we'll talk about the different types in a minute. And there's only a few, and if you have sheep and goats, that there's not a lot of big investment by chemical companies to make more dewormers for us, because we just have sheep and goats and they're not considered a major species. And so we need to take really good care of the dewormers we have and manage them properly so we don't develop too much resistance among the worm population. So there's 3 drug families, and these are some pictures of some, but one is the benzimidazoles, and they all end in zole. Fenbendazole, which is Safeguard, albendazole, which is Valbazin, and oxybendazole, which I don't know what that actually, if that has a commercial name. And these are white. They look like Elmer's glue or like the sap from a milkweed. And they're kind of sticky like that. They're white. The white, also called the white dewormers. There's the nicotinics, levamisole, which is also known as Prohibit, Morantel, and Pyrantel, which are other dewormers. And these are a little, we'll talk about them more in detail in just a minute. I won't get carried away here. The macrolids are the ivermectins. Most of them end in ectin. Ivermectin's probably the most well-known. Remember when ivermectin first came out, it had to be maybe in the 80s. I was at a national extension meeting, and the people that make ivermectin were actually talking to us, like letting us do interviews with them to take home and play on the radio, because this was a totally new type of dewormer. And boy, it wasn't that long ago. And now a lot of the worms are resistant to ivermectin, but there is cydectin and doramectin. I think cydectin is actually maybe moxidectin. And they can still work in some situations. One of them, like ivermectin, works pretty well at home, but not at work for me. We'll talk about how you can tell whether they're working or not as well. So these are the white drenches we talked about, the ones that look like Elmer's glue. Safeguard or Panicure, you may have heard those names. Also approved for goats, which is unlike many things. They're very broad spectrum. They're very safe. I'm pretty sure that for the deer fluke, Dr. Smith had me give 5 times the dose on the bottle, which seems like it might kill him, but it didn't. Saved him, actually. So it has a wide margin of safety. It's effective against tapeworms. It's the only class of drenches that are effective against tapeworms. And valbazen, which is also is effective against adult liver flukes, the regular kind of liver flukes. And it says here should not be administered to pregnant animals, but I thought that said, and Todd, you can argue with me if you think so, in the first trimester, you're not supposed to use it.
Right.
45 days after breeding.
It's primarily in the first trimester.
It can cause birth defects. We can see some pictures.
Abortion, yeah.
Oh, abortion also. That's good.
Right, because of the birth.
Of the birth defects. Okay. So you do want to be careful of that. And so if you're breeding your animals in the fall, or some people are breeding them early now for January, February lambs or goats, you could have pregnant animals that you're deworming. You want to be careful with the valbazen. And one of the things you often see at the like Tractor Supply, they have the little tiny bottles of Safeguard there. And are you going to talk about the dosage on those?
No, you have a table that you'll be sending people.
Okay. You might want to look at the table because it might be different than what's on the bottle.
Right. The table is from the American Consortium for Small Ruminant Parasite Control. And so what they did is put what they felt were effective dosages, and then they contacted FARAD, which is the Food Animal Residue Avoidance Database, and they contacted the veterinarians there and got from them fairly official recommendations for the withdrawals at the amount that they were saying you should use. And so those tables are really good to look at, and you can share them with your veterinarian and discuss them with your veterinarians, those tables, because you would be then giving the dewormer off label if you're not using it exactly the way the label says to. And so technically you should have a vet prescription to do that.
So I will send those charts. I downloaded them today. And those will be coming out in your follow-up email. So the nicotinics, levamisole, I've used Prohibit. They also come as the drench is ideal. They do come as a bolus, but I can't figure out how you would ever do boluses and adjust for the weight of the animals. You'd have to be cutting them into thirds and halves, and it's not that easy to give a bolus to a sheep or goat. Besides, it's much easier to drench them. So there's Tramadol, Levamisole, and Prohibit is the one that seems to be available now, and it's a powder that you mix up. So you have to read the directions on the back and mix it up correctly. I mix it at the stronger drench. I find that easier to give because it's less volume of drench per animal. But you have to do a good job drenching them, because this is not as safe as it doesn't have as big of a margin of safety as the white drenches do. And Morintel, also known as Rumatel or the positive goat pellet, and Pyrantel, which is Strongid, which I don't think is actually approved for sheep or goats, but those of you with horses are be familiar with Strongid. So here they are. They just put all that stuff right up there that I was just talking about. It is a broad spectrum, and it says it's effective against arrested larvae. Is that the ones that are in the sheep in the winter that have gone to sleep?
Right, that would be the other name for hypobiotic or hibernating or dormant larvae. Those would be the L4 larvae that often hibernate in the wintertime. Or if there's
So I didn't think any of the dewormers were effective against those, so that's interesting.
oh no, they are, but it just takes, they're just harder to kill because their metabolism is slowed down.
Oh yeah, that makes sense. And they do have a narrower margin of safety. It says especially in injectable products, but hopefully you're not going to be using injectables of this type on your sheep and goats. You should be using a drench.
Yeah, I think the levamisole no longer comes out as an injectable for sheep and goats. It's
Okay, yeah, I've never seen that one. But
another powder that you mix with water.
yeah, that's the prohibited one we use.
Right.
The macrolids, ivermectin, you'll see that in a lot of forms. Like Epronex is a poron, but that's, you know, for cattle. Promectin, haven't never seen that one. Zimetric, ivermectin. Doramectin is Dectomax. For a while, there were people trying to use that to inject their sheep, which is off-label.
Betsy, I think if you hit enter, it'll bring up the information.
Oh yeah, I forgot that. Thanks. They're broad spectrum. They have a wide margin of safety. They're effective against sucking external parasites. Moxidectin is the newest one, has a little persistent activity, which I don't know if that's a good thing or a bad thing as far as resistance goes, but I suppose it could help if you're having a problem. Cydectin is approved for sheep and goats now, or at least for sheep. I can't speak for goats, but the bottle I have has a sheep dosage on it. And I don't think Dectomax, we're going to talk about that actually. I think I've got a thing here. So approved for goats, fenbendazole, which is Safeguard, Rumetel, and Valbazin. So you've got two in the white dewormer group and another one. And then approved for sheep is Valbazin, Ivermec. Cydectin is approved for sheep. I added that one to the slide because it wasn't on here. And levamisole, which is the prohibit. So it's very confusing because there's like two names for everything, the chemical name and the trade name. So the use of a product that's different than its label is extra label use. And that requires a vet prescription in context of a valid, you have to have a relationship with this vet for them to make a recommendation. And then you have to remember if you're milking your sheep or goats or cows or whatever, that there's a whole different withdrawal, and not that many of them are approved for dairy animals. And as a result, you should use exaggerated withdrawals when you're using them extra label. So keep good records, and you can check, there's the website, you can check to see what the withdrawal could be, or actually your vet usually has to do that, I think. I did look once, and you have to put in your veterinary license, I believe, to get that.
Though Betsy, what they've added nowadays is they have a frequently asked questions section.
Oh, I haven't looked lately.
Yeah, and when you look there, it often gives you information about someone else who's asked about what's the withdrawal for, you know, Ivermec drench if I'm using it on a goat instead of a sheep. But it's technically your vet is going to be writing a prescription for you for the use of that drug off label. And so your vet can check, but you can also look online since most, you know, and give that information.
Mm-hmm.
And then, as I said, Betsy's going to be handing out a table where the American Consortium already talked to FARAD about the dosages they're giving and gives the withdrawals that at that time FARAD gave them for it.
Right. So now that we've talked about the drugs, we didn't talk about giving them. Are you going to talk about that, Todd? Like
Yes,
not underdosing and.
Yes, evidently I talk about that. It turns out
Yeah.
I went, oh, it would have been good to have put that forward. So we're gonna switch screens now. Okay, if that's okay, Betsy.
Yep, I'm going to stop sharing. There you go. Now that way she can control the PowerPoint herself. And we're going to talk about a lot of different things you can do. And it is a challenge for those of you that only have a couple animals, for example. Your strategy is going to be different from somebody that has 1,000 sheep or something like that. So you have to think about what can apply in your situation, and then, you know, try to do it. And it's not always easy, I will say. It's sometimes very frustrating. There you go. It just came up, Todd.
All right, thank you. All right, so I'm going to go ahead and talk about some of the things you can do as far as grazing management to help reduce primarily barberpole worm problems. And a lot of this is going to focus on barberpole worm. And so the amount of pasture contamination you're going to get with your worm eggs is often influenced by the height of your pasture that you're grazing at, how long you're grazing that particular paddock before you take the animals back out of there, and then how long you rest that paddock before you bring the animals back in. And it's going to be really easy for me to give you recommendations, but these recommendations may be impractical for you when it comes to the entire grazing cycle or for your particular farm. And so because of that, when you talk about trying to have these uncontaminated or fairly uncontaminated pastures, you're going to want to do this grazing management primarily with your most susceptible animals. So giving priority to those animals, and that's going to be your recently weaned young stock, your lactating does and ewes, especially those that have kids or lambs at their side. And then lastly, your dry animals, which are going to tend to build up more immunity. Okay, so the first thing I'm going to do is go through the life cycle of barberpole worm a little bit, and to sort of give us an idea of what's happening out in a pasture. And I'm going to sort of start out with thinking about, okay, it's May 1st and your animals are going out to pasture for the first time after winter's over. And Betsy went through some of this, so I'm afraid some of this will be a little bit of but it's complicated. So it's probably good to go through it twice, all right? So the eggs are in the feces. You let your sheep or your goats out into that grazing paddock and they squat down and they pee and then they poop. And you've got fresh eggs in that poop. And when it comes to barberpole worm, it requires things to be somewhat warm before that worm is actually going to hatch. It does start hatching at as cool as 50 degrees. And by 60 degrees Fahrenheit, you get lots of response. And it also requires some humidity. And in studies they've done in the lab, it takes about 3 to 5 days for the barberpole worm to hatch when it's in the upper 70s, and a lot longer to hatch when it's in the upper 50s, or I mean low 50s. But in reality, in New York, once May comes, our temperatures start heating up pretty quickly. So it's really only in the fall that you get really long periods of time when it's 50 to 52 degrees. So in general, we usually say the eggs are going to hatch from 1 to 6 days. In the warm, hot weather that we had this summer, a lot of those eggs were probably hatching within the first 24 hours. And they hatch into what's called an L1 larva. And that L1 larva doesn't leave the fecal pellet. It just sits in there and it eats bacteria. And then it grows and it molts and it sheds its skin just like a snake would. And it becomes an L2, and the L2 does the same thing. It just eats bacteria in the feces and stays in that fecal pellet. If a dung beetle comes along and buries that pellet, it can't get out of that pellet, okay? It's just pretty much stuck in there, okay? And keep in mind that direct sunlight can heat that fecal pellet up to 155 degrees Fahrenheit. And at that point, it'll kill that L2 larva or that L1 larva inside the pellet. And so because of that, that first run through a pasture when the pasture is still pretty short, if you mow that pasture right after the animals have left it, and there's a lot of fresh eggs and L1 and L2 larvae in the fecal material, if you mow it on a really sunny day and the sun's able to hit those pellets, it can do the sterilization. Unfortunately, later on in the season, when you mow it short like that, there's going to be a nice covering of mulch usually over that fecal pellet. So you're not going to get that direct sunlight on it. Shade trees and tall, dense grass are going to help shade that pellet and help those worm eggs survive. and help those L1 and L2 larvae. The L2 then molts to become an L3 larva. And the L3 larva is what's infectious. If your goat or sheep had swallowed up that, fecal pellet with the L1 larva in it or the L2 larva in it, that L1 larva or that L2 larva will cause no damage to your sheep. Okay, it's the L3 that is the infectious one. Okay, and because this L3 is going to have to escape from the fecal pellet and it's going to live outside of the fecal pellet. And because of that, nature has made it so that it doesn't get rid of its second skin. That second skin from when it was an L2 stays on it, and it gets an L3, it gets a second skin as well. And the first skin doesn't come off of the mouth. So this L3 larva can't eat. It can't eat bacteria. It can't eat anything. Okay. And it has to live off its stored reserves. But the problem is that worms are cold-blooded. And so in hot weather, their metabolism speeds up, and this L3 larva can survive about 30 to 60 days without eating. And in cold weather, where its metabolism is slower, it can live up to 120 to 240 days. And we used to think that the L3 larva couldn't survive freezing when it came to barberpole worm. And your other strongile worms have very similar life cycles, but they tend to hatch at a cooler temperature than the barberpole worm does. They don't need that 50-degree temperature. So it takes about 5 to 14 days for the worm to go from being an egg in that fresh fecal pellet to being an infectious L3 larva. And at this point, your pasture is now infectious. Betsy, there's someone that needs to get, Olivia needs to be admitted back into the back from the waiting room. And so that 5 to 14 days really varies depending upon what the temperature is like. The cooler and drier the temperature is, the longer it'll take it. The L3 larva in California and places like that will die in heat waves when it's really, really dry. Unfortunately, we usually get heat waves that are really wet. And probably this last summer, with how warm and wet it was, that L3, the eggs may have been becoming an L3 in as early as 3 days. Okay, most of your L3 larvae, and you can see them in this dewdrop on this grass, can't crawl up, can't move up with the morning dew or with the rain more than about 2 inches high in grass. About 80% of them are going to be 2 inches or lower in your grass. Okay. So the L3 has to escape from the fecal pellet in order to infect an animal. It can only live about a week or two inside a fecal pellet if it's hot or dry. The pellet needs to be broken up by rain for the L3 larva to escape it. But that only requires about 2 inches of rain in a month's time. And unfortunately, in New York, we usually get those 2 inches of rain. And then it moves around on water. It can get under leaves, or generally what it does is in the morning dew, it comes up tall on the forage, and then as your morning dew dries up, evaporates, it recedes back down into down towards the ground. And its survival of the fittest, so only about 2 to 10% of the eggs actually end up as L3 larvae. And in the tropics, the population of L3, after the animals have come into a pasture and started dropping eggs in that pasture, the L3 peaks at about 14 days later. And in New York, unfortunately, it's not 14 days later. In our temperate climates, it's more like 35 days later it peaks. So that infectious worm population is peaking about 35 days after that fresh manure got deposited on the pasture. It needs to be eaten by a goat or sheep to continue development. And cattle can get Homunculus contortus, can get barberpole worm as well. But cattle and horses, they don't share the exact same strain of barberpole worm. And barberpole worm is fairly species specific. So while sheep and goats share the same barberpole worm, there's really only one strain of barberpole worm that young calves get that sheep and goats also get. Okay, so if you have your cattle or horses come in and vacuum up those L3 larvae, that'll help stop its life cycle. It won't be able to lay eggs in them, the barberpole worm that came from that sheep or the goat. And so ideally, if you can bring those sheep or goat, those cattle or horses on about 35 days after those eggs were deposited during the grazing season, you'll have a whole bunch of L3 larvae there that your horses and cattle can be running around vacuuming up for you. And we used to think that the L3 barberpole worm larva couldn't survive outside in the Northeast over the winter. But they've done studies at the University of Maine where they took barberpole worm larvae that were hatched out of Maine sheep and goats, and subjected them to really cold temperatures. And they found that the ones in Maine that are now in Maine can tolerate 10 degrees Fahrenheit for up to 3 to 6 days before they die off. Versus they took worms that they got, L3 larvae they got from sheep and goats in Georgia, and subjected them to really low temperatures, and they found that they died off at about 20 to 25 degrees Fahrenheit. So unfortunately, the barberpole worm, as it's moving north, it's being it's selection of the fittest, and it's being genetically selected to be able to survive colder and colder temperatures.
Hey, Todd, maybe we need to get some of those Southeast barberpole worms and crossbreed them with
Yeah, I guess so. That's a good point. That maybe if you bought a buck from Georgia, it might not be that bad if he's bringing up worms.
Right, if he brings a few.
I don't know. I'm not too sure about that, but yeah. Once the L3 larva is inside the goat, or sheep, once your animal has eaten it, it gets rid of that covering over its mouth, and that's called exsheathment. And it can now start eating, and it makes a decision on whether it molts into an L4 larva. And that L4 larva has to make a decision on whether to go ahead and become an adult or go into hibernation. Okay, go into suspended animation. And it makes that decision based on how many adult worms are already in that animal. And if there's already a whole bunch of adult worms there, it goes, whoa, I don't want to become an adult now. There's too much competition. I'm going to hibernate. Or it also gets cues as to whether it's wintertime. And in wintertime, it goes, oh, it's not worth being an adult right now. I'm going to go ahead and hibernate. Okay. And I'm going to now talk about evadance or avoidance parasite grazing. And this is when you base a lot of your grazing decisions on the parasites rather than necessarily on the nutrition of your pasture or the health of your pasture as far as the health of the plants, what's healthy for the plants. And so with evasive or avoidance grazing, you want to move your sheep or goats out of that grazing paddock fast enough that you prevent them from getting infected with the feces that they've deposited in that pasture during this little grazing period. So if you brought them in here 3 days earlier, the chances are there's no mature larva unless it's been really warm and wet. And so they're not going to get themselves reinfected. If you're leaving them in there 7 days, there's a lot more chance that there's infectious larvae from the feces that they pooped out the first day they were out there in that pasture, and they can reinfect themselves. And so we usually say that during the grazing season, it takes about 5 to 14 days to go from being an egg to being an infectious larva. With it being 5 days when the conditions are warm and wet, and 14 days later on, like in the fall, okay? So our recommendation normally is to play it safe by moving your animals out of a pasture within about 4 days during the warm, wet part of the grazing season. So May, June, July, August, and then September, October, November, move them out more like every 7 days, move them out of the area. And you also want to move them earlier if the pasture is getting too short, i.e. if it's around 3 inches or so, you're going to want to move them out even if they've only been there a day or two, because remember, most of those worms are in the bottom, are in that 80% of the worms are in those bottom 2 inches. And when there's only 3 inches of grazing, they're going to be doing a lot of grazing at 2 inches. So these recommendations about moving the animals out within about 4 days and moving them out before the pastures gotten very short, those are also very helpful when it comes to the pasture regrowing back nice and fast, and the plants staying nice and healthy and surviving. And also when it comes to the nutrition of your pasture. All of those recommendations are really good there. And one thing you can do, because it's is when it's warm and wet, like right now, where you think the life cycle may be even shorter than 4 days as far as becoming an L3 larva, you can move the fence forward every single day, but move the back fence up every 4 days. So the animals are getting new grazing every day, but they have no opportunity to graze back more than 4 days because you're moving that back fence up every 4 days at least. Okay. Now the problem with evasive or avoidance grazing is you're also supposed to allow a long enough rest period between when you use that pasture and when you use it again, when you use that paddock and when you use it again, that you get substantial die-off of those infectious L3 larvae. And we showed earlier that L3 larva can live for quite a long time. And so we're generally saying that you want to leave them out of that pasture for 60 days, even up to 105 days. And this is why in the old days, they used to say that pasture management didn't really matter, because they'd say, hey, how could anyone rest a pasture that long? Okay. And so the problem is that these long rest periods are longer than what you're going to normally recommend for the health of that pasture, as far as it regrowing back again really fast after it's been cut, and also for the nutritional value. And you can see in this slide that these goats came in here the day before, and and the stems of this grass were lignified enough, which that lignin, that fiber like that, isn't going to be as digestible by the rumen. And they sort of knocked it all down, and they broke out into a hayfield that had been mowed 2 weeks earlier and grazed out there instead. So there's still plenty of good blades and stuff on the grass, but that's just a trade-off that you have to remember, that by doing these long rest periods, your pasture is going to be pretty mature unless you can think of something to do. This is a study they did at West Virginia University with their organic sheep flock, where some of the animals were rotated through the pasture so that they were on a paddock for 3 days, and then it was rested for 57 days before they came back to that same paddock. And then the other sheep were kept in a pasture for 7 days and then did not return to that same pasture or paddock for 21 days. And what they found was that the animals where they practiced avoidance grazing had half as many worm eggs, strongyl worm eggs. And they were able to market 83% of the lambs as organic, versus in the other pasture, they had twice as many worms, and they had to deworm 53% of the animals and lambs, and so weren't able to market those as organic. And the weight gains were also better on those ones that had the longer rest periods, probably because they had less of a parasite load. So things you can do: are there safe pastures that you can put your animals onto as the grazing season progresses? Do you have some brush pastures, or do you have hayfield regrowth, which we're lucky enough at our farm that's what we have? Starting in July, we can put the animals out on that, July, August. You have pastures that your cattle and horses have been grazing that you can switch your sheep and goats with your horses and cattle. Do you have crop residues? Do you have annual pastures, or there's some tall, very, very tall annuals that your animals can graze? Or can you disrupt the worm cycle by mowing the pasture extremely short at the beginning of the rest period? If you've got a 60-day rest period, you can mow it real short, and it doesn't matter that pasture is going to take a long time to grow back. Can you graze another species like horses or cattle there during the rest period? And that's what we do at our farm. We bring our horses onto the pasture about 30 days after the goats have gone through it and have them graze it. Or can you harvest a hay crop or baleage, green chop off of that pasture before you resume grazing? And then, like I said, you can go into some browse, but the only problem in New York with browse is that our deerworm have a lot of, or our white-tailed deer, a lot of them have deerworm. But keep in mind that 80% of the worms live in that first 2 inches of vegetation. Deerworm, unfortunately, the brush snails that have deerworm often can climb 2 feet up in the brush. And then there have been some studies suggesting that grazing high tannin forages may reduce the effects of barberpole worm. Okay. And can you control your barnyard effect? So barnyards are really any area you have on the farm that has good forage on it that the animals can eat, and unfortunately also has a high amount of manure on it, which means it's got a high amount of contamination with worm eggs. And these barnyards or these pastures that are often the pasture you used over the winter because it was right against the barn, or the one you used for lambing because it was right against the barn. Unfortunately, these barnyards or little pastures that you didn't rotate can contribute greatly to herd contamination with internal parasites. Keep in mind that rotational grazing in the spring, even if you can't practice these long rest periods of 60 days to 105 days, still can help reduce this barnyard effect and delay the onset of summer parasite problems. And we did a study where we took 3 farms in Vermont, and one of those farms didn't rotate at all. They just continually grazed a really huge pasture. And then we did the same thing in New York. We took 3 farms, and one of the farms continually grazed a really, really large pasture versus the other 2 farms on each state rotated their pastures, but they weren't able to do these 60-day rest periods. They did shorter rest periods than that. And by July, you can see that that rotating 1 and rotating 2 herds, they had a lot of worms. They had like 3,500 or 2,000 worm eggs. And those farms at that point switched those animals onto hay fields or onto brush pastures or pastures their cattle had been on, or their horses. So they did have worms, and it was a good time to move them. But if you look at that pasture that was doing continuous grazing, and this happened at both farms, they had almost 24,000 worm eggs per gram, and they were losing goat kids to worms. They were dying from the worms. And so even if you can't do those long rest periods, rotations can still help you. Some options to help reduce barnyard effect are laying down gravel or concrete, or spraying with herbicides in those barnyards, closing off access to the barnyard. If you bring your animals in at night, just make it so that they can't go into those barnyards. Make the barnyards small enough that there's no real forage growing in them to tempt the animals, or put in lanes or leave your animals out 24/7, Okay. In the spring, we often see a rise in barberpole worm populations. And this is because the barberpole worm has generally overwintered as these dormant, hibernating L4 larvae in the host animals, in the goats and sheep. And it gets a couple of different triggers letting it know that springtime has arrived. One, if your animals are giving birth, your sheep and goat, your does and your ewes put out estrogen as they're getting ready to give birth. And the female worms have estrogen receptors. So they go, whoa, worming's going, or lambing and kidding are going on. This is a great time for me to stop being an L4 larva and become an adult worm. Also, they're able to get a trigger of the amount of melanoma in those sheep and goats. And so they're able to tell that the day length is changing, that the days are getting longer, and that can help them. Keep in mind also that the immune system in your goats and sheep is compromised by parturition, and it's also compromised by illness, regardless of the time of year. And when the immune system is compromised, the L4 larva also gets a trigger that the immune system is compromised and will break its dormancy then as well. And this same phenomena occurs in other strongyle worms, but not to the extent that it does in barberpole worm. Okay. This was a study they did at University of Maine with their Icelandic sheep, where they had the sheep in the barn, and then they looked at different ways to control the spring rise of worms. And what they did is the blue line here are ewes that went out to pasture May 15th. So at this farm, they went out right when the spring rise was at its peak. The animals, I believe, were lambing in March, and the L4 had become had become adults, and the eggs from these larvae that had from these worms that originally had been born in 2014, these eggs were peaking at the population of eggs was peaking right about May 15th when these animals were sent out to pasture. Versus the red line is sheep that they kept in the barn for another month and didn't let them go out to pasture until June 15th. And by that time, they were cleaning the barn of manure. You know, they were cleaning the manure out of the barn. And by that time, these L4 larvae that had become adults had really stopped most of their egg laying. Their population had gone way down by then. And what they found is that the ones that went out May 15th, they reinfected the pasture with eggs really quickly, and their worm eggs were really high by June 15th, and they actually needed to deworm their lambs by then, the lambs that were at these ewe side. Versus the other ones, because they went out after this rise, after the rise was over, and once the egg count was down quite low, the pasture took a lot longer to get infected and really didn't get infected until mid-June. I mean, mid-August, and then the cold weather arrived. So they didn't have to deworm most of those lambs. Okay, but unfortunately, of course, they lost a whole month of grazing forage. And I'm not sure how many farmers are going to be willing to keep their animals in the barn and feed them hay for an extra month. I'm now going to switch over to talking about the immune response that animals have to worms. And keep in mind that good nutrition stimulates the immune system. And vitamins or minerals such as selenium, copper, and zinc are all very tightly involved in having a good working immune system. And vitamins such as vitamin E are also really important. So one thing you can do is make sure that your animals are getting a sufficient amount of of their trace minerals and of vitamin E. We already talked about how lactating or late pregnancy animals generally don't have, their immune system is compromised, and so you can get this spring rise in worm egg hatching because of the L4 larvae breaking dormancy and becoming adults. But what they found is that if you have diets that contain 130% of the daily crude protein requirements for late pregnancy ewes, that this will actually reduce that flush of egg laying, or it will reduce that spring rise, because this extra crude protein helps the immune system mount an attack, okay? And they haven't done these experiments with goats, but the general thought is that it also helps with goats. So that's why one of many reasons to consider giving your animals more protein in late pregnancy than the basic requirements for late pregnancy sheep or goats. Okay. The last National Resource Council recommendations for goats and sheep were done in 2007. And at that time, they upped the requirement for vitamin E for sheep and goats quite a lot. And so University of Rhode Island did a study where they compared the old requirements to these newer requirements, these 2007 requirements. And they took lambs that they had weaned, and for their creep feed, they added 5 international units of vitamin E per kilogram of live weight to the creep feed for half the lambs, and the other half of the lambs, they gave the new requirements, twice as much vitamin E. And then they artificially infected the lambs with barberpole worm larvae. And they found that the ones that had the higher level of vitamin E in their creep feed had half as many worm eggs, shed half as many worm eggs. Okay, so that really helps to emphasize the importance of vitamin E. When it comes to genetic resistance to worms, keep in mind that yes, your sheep and goats, not only are they affected by the environment, but they're also affected by the genetics they've inherited. And the heritability for genetic resistance to strongyle worms is actually very similar to the heritability for milk yield. And so just the way they've made lots of progress with milk yield in dairy cattle, we could, if we put our mind to it, do a lot of improvement for genetic resistance to strongyle worms in our sheep and goats. Just like with milk yield, it does require lots of records. You would often be comparing the fecal egg count for offspring of different sires. And if you have a meat goat or a meat sheep farm, you can enroll in the National Sheep Improvement Program's on-farm genetic evaluation program. And they look at 2 traits for worms. These are strongyle worms they're looking at, not strongyloides and not the protozoa coccidia. They're just looking at strongyle worms. And they look at the count at weaning, and then also the count about 30 to 60 days after weaning, and then send out genetic proofs for sires and dams based on the results of their offspring. And so that is something you can consider joining. Okay, so what is the mechanism of biological resistance of your sheep and goats to barberpole worm? The animal's immune system has to do 2 things. It has to recognize that it's gotten a parasite infection. So it has to recognize that it's been infected with barberpole worm, and how quickly this occurs varies between breeds and individuals. And it has to mount an effective response. And this effectiveness also varies between breeds and individuals. This is a study that was done at West Virginia University, where they compared St. Croix sheep to Suffolk sheep, Suffolk crossbred sheep. And you can look at this chart these charts down here, and the green line is animals that had been artificially infected with barberpole worm previously, and then given a dewormer or something to get rid of that infection. And then they're being infected a second time now. The red line is animals that are being infected for the first time. And then the blue line is animals that aren't being infected at all. And that was sort of to make sure that there was no other way that they were getting barberpole worm. And if you look at the St. Croix sheep, you can see that the sheep that had been previously infected, as soon as they got infected again, they were able to keep that barberpole worm infection down completely. There were no eggs shed. Versus when you look at the Suffolk sheep, that green line went back up at about 2 weeks after they were infected. The line went back up, and they did show an immune response when they got about 3,000 worm eggs per gram, and it did go down, but then after 6 weeks, it's starting to go back again. For the animals infected for the first time ever, 2 weeks after they had been infected, they started hatching out worm eggs, or they started producing worm eggs in the feces. They had enough adult worms to do that. And the St. Croix sheep realized that about 2,500 worm eggs or so, that, hey, I've been infected. And they mounted an immune response and brought the worm load back down again by 5 weeks after infection. Versus the Suffolk sheep, it took them until they were about 7,000 worm eggs to realize that they had been infected. And then they mounted an immune response, but it was somewhat short-lived. By 6 weeks, they were starting to go back up again. And if we look at the macrophages that are attacking the worms, you can see that they've attacked these they've attacked this barberpole worm here in the abomasum, or actually, I think this is more in a petri dish. And that worm isn't able to move around much at all. Versus if you look at this prime Suffolk, that even though the macrophagia have attacked it, that worm is still able to move around a lot. And so probably could still suck blood from the lining of the abomasum. Okay. Traditional parasite control in the 70s and 80s sort of planned that you were going to maximize your parasite control, and that would maximize the production from your animals and the health of your animal. And you would deworm the herd regularly. If your dewormer stopped working, there'd be a new dewormer showing up. And you would rotate your dewormers maybe during the year or every other year or something. And you would move the flock onto a clean pasture at the time you dewormed them, so that those eggs that were hatched, that day or two before that adult worm died wouldn't be contaminating your pasture. Okay, all of these practices unfortunately promoted dewormer resistance to the Barberpole worm because of its being a heavy egg layer and it having a short generation interval, and it's now a major problem throughout the US. And this was a study we did here at Cornell in 2007, where we sampled goats at a bunch of New York farms and also some Pennsylvania farms over the border from Elmira and stuff. And we already found in 2007 that about half the herds were already showing a severe resistance to safeguard. And those red checkered ones mean that when you gave the dewormer, it killed off 100% of those worm eggs, or that 2 weeks later, all the adult worms were killed off because the worm eggs per gram dropped to 0. Unfortunately, in that blue group, it's only killing off about 60% of the worms or less. And when you looked at the ivermectin, the results weren't quite as bad. It was killing off about one third of the farms were showing already a severe resistance to ivermectin. And unfortunately, my farm is that #1 farm there, where it's saying it's close to -10, which means that there were more worm eggs in the feces 10 days or 14 days after deworming with ivermectin than there had been when they first dewormed with the ivermectin. So the ivermectin was essentially like candy. So the traditional leads to dewormer resistance because it's destroying the refugia. And the refugia is just a fancy name for the proportion of the worm population that has not been exposed to the dewormer treatment. And it's in refuge from the dewormer. So it would include the worms in untreated animals and also the eggs and larvae that were already on the pasture before treatment. So the worms, they might have survived from the previous time your goats and sheep were out on that pasture. Unfortunately, because most of us have dewormed in the past, most of our worm populations have at some point been exposed to worms. Okay, but hopefully you've got this pool of genes that's sensitive to the dewormer, okay, that hasn't directly experienced this dewormer before. And I'll show you how this can help dilute the genes that are resistant to the dewormer. Okay, so you have your susceptible parents and your resistant parents. You give them the dewormer, and the only worms that survive after you give them the dewormer treatment are the resistant worms. And so they mate together, they mate with each other and put out worm eggs, and the worm eggs they're putting out are all resistant to this dewormer for the most part. Okay. And I'll go through that a little bit more in a little while, but first I'm going to talk about effective use of dewormers. And few of your dewormers, as Betsy said, are approved for use in goats. Okay. We normally recommend, because goats have a fatter rate of passage of chemicals through their bodies, they have a faster rate of digestion, and they have larger livers than your sheep or cattle for their metabolic size. We usually recommend that you give them 1.5 to twice the sheep or the cattle dose per pound live weight, okay, when deworming them. And you'll want to talk with your veterinarian. In sheep and goats, you don't want the dewormer to linger in a low amount for a long period of time. So because of that, we don't recommend using pour-on dewormers. And we also don't recommend giving the dewormer as an injection, okay, because it lingers then as a low amount in the animal. and can help build up dewormer resistance. Instead, we want you to give it orally at the back behind the tongue. If it goes too close to the front of the mouth, the animal can have a gag effect, which will send it to the true stomach. And it'll break down, and that in the true stomach, in the acidity of the true stomach, the dewormer is going to break down faster. And then always observe the proper withdrawal period. And the trouble with dewormers in your feed, like that positive goat pellet, is if you have a lot of animals, it's very hard to make sure that they all got the same amount of dosage in their feed or water. If you've just got a couple of dairy goats and they're jumping onto a milk stand and you're making sure that they eat it all while they're on the milk stand, then you can control more the amount and make sure that everyone got the right amount. Okay. You can increase the effectiveness of a dewormer once you're starting to see resistance by holding your animals off of feed for 16 hours and then deworming them and keeping them off of feed for 12 more hours. Obviously, you wouldn't want to do this to a late pregnancy ewe or doe because it could easily push her into ketosis. You're not going to want to fast a late pregnancy animal. Also, for those white paste dewormers, deworming them twice 12 hours apart, so you would give them the full dose 12 hours apart, can be very effective. And then you can deworm them another thing you can do is deworm on the same day with 2 dewormers. You don't mix the 2 dewormers together. You give them one and then you give them the other with 2 dewormers from 2 different families of deworming. And you would only only do this if you're selectively deworming. You wouldn't do this if you're deworming the whole herd because you're just going to build up resistance even faster if you're doing it for the whole herd, giving them those 2 dewormers. There have been a lot of studies that have shown that targeted selective deworming is going to prolong your dewormer efficiency, is going to delay that dewormer resistance. And keep in mind that your parasites aren't equally distributed in all individuals. You've got that bell-shaped curve, just the way you do with milk yield. Some animals are more resistant than other animals. About 20 to 30% of your sheep and goats in a flock will harbor about 80% of the worms. And those 20 or 30% are going to be responsible for most of the egg output and most of the pasture contamination. So you just need to deworm those animals, not the entire flock. Okay, and so here's an example in a goat herd. Each one of these pink bars is an individual goat, and 1/3 of the goats are carrying 80% of the worms. Okay, so if you could deworm that 1/3 of the goats, it would really cut down on your pasture contamination. Okay, and so after you've dewormed that 1/3 of the goats, then you send your animals out to the next grazing paddock. 1/3 of these goats have these highly resistant genes to barberpole worm. But the rest of your goats, the rest of the eggs that are being pooped out haven't been selected in this generation for dewormer resistance to whatever dewormer you used. And so they're going to, your animal is going to go out in that pasture and it's going to be taking a bite of L3 larvae that are highly resistant, and then lots of bites of L3 larvae that haven't been exposed to that dewormer this generation. And so once they're inside the animal and they're crossbreeding, you have a lot more chance of those resistant genes being diluted in that general worm population inside your animal. Okay. So how do you determine who to deworm? You can do fecal egg counts like, that example that I showed you there, but it's costly and very time consuming. Even if you do your own fecal egg counts, it's time consuming to do them. And it also doesn't identify animals that have a low tolerance to barberpole worm, but for some reason or other aren't shedding a lot of eggs. Maybe they have diarrhea from other worms and it's diluting their eggs. And you can also look at visual cues or production records to get an idea. And what we usually say is use a 5-point check, okay? And you want to be sure to include FAMACHA in your 5-point check because FAMACHA is going to monitor anemia, and anemia is the main sign that you're going to have a Barberpole worm. And otherwise, the other things your 5-point check is going to can include are things like diarrhea and poor growth. And the FAMACHA system was developed in South Africa because of the severe dewormer resistance they were experiencing there in their sheep and goats. And it's a method of selective deworming that really cuts down on the number of dewormings given to individual animals in an entire flock. Okay, rather than deworming all the animals every 6 weeks, only some animals are going to be repeatedly dewormed. And it's been shown in studies to significantly decrease the rate of development of dewormer resistance. Here's an example 5-point check that we often use in the Northeast US. So you'll look at the body condition of the animal. You might look at the weight gain if you've got those recorded. You might see which lambs aren't growing as well, as haven't grown as well these last 2 weeks compared to the other lambs in your herd, in your flock. And you'll look at the hair coat on the animals. Is it rough or is it nice and shiny? You look at the DAG score, which is what the feces looks like. Is it diarrhea or if it's sperm? We said FAMACHA is a way to look at how anemic the animal is. Also, how well the animal moves. Is the animal lagging behind the other animals? Just like an anemic person, that animal is going to tend to lag behind the others as they move from pasture to pasture. And then you'd look to see if a bottle jaw is present or not. And all of these things, you may say that if it's got any one of these things, you're going to deworm it. Bottle jaw can be caused by other things as well, like we talked about liver fluke. But you'll look and see, does it have one of these criteria? And in that case, should it be dewormed? A little bit more talking about FAMACHA. It screens for anemia, so it's really only good when it comes to strongyle worms on the Barberpole worm, which is the only one of your strongyle worms that really causes severe anemia. And you're going to look at the color of the membrane inside the lower eyelid. You push down on the upper eyelid, so you're pushing the eye into the eye socket. That causes that membrane to push out on the lower eyelid. So it's really easy for you to see it there. It pops out. And you're going to treat your adults at scores 4 and 5, and your lambs and kids at scores 3, 4, and 5. And you'll also use other things to help you make your decisions, like that 5-point check. And you don't want to count only on this. It needs to be on this. It is fairly labor intensive and stuff, but you'll want to combine it with other management practices as well. For accuracy, you're supposed to do FAMACHA in the sunlight. And obviously in New York, we don't always have very bright sunlight. If you are doing it in a barn, a 500-watt quartz work light will be sufficient enough light, or if you've got a skylight, or you're doing it near a window, right by a window in your barn, that will also help with the lighting. Okay, and we do it at least every 2 weeks during the grazing season. You can often get away with doing it more like once a month during the winter. And you want to take a certification course, which is what you guys are doing right now for the most part. And be aware that there's other causes of anemia, such as sucking lice, liver flukes, different diseases, etc. Also other causes of red membranes. If your animal's just been running in the wind and there's a lot of dust, or if your animal's running a high fever for some reason, that can also make the membranes higher. Okay. Ideally, there's going to be less than 10% of your animals in categories 4 and 5. So you're going to treat the 4s and 5s in that case with an effective dewormer, which is a good reason to be doing fecal egg counts and finding out what dewormers do work on your farm by comparing fecal egg counts before and after deworming, 2 weeks after deworming versus right at deworming. And you're going to have to decide whether to do your 3s or not, okay? And then you're going to re-example your herd 2 weeks later. The trouble is that if greater than 10% of your flock or herd is in categories 4 and 5, you're going to deworm the threes anyway. Normally in the previous slide, you wouldn't be deworming the threes unless they were lambs or kids, or they were heavily milking sheep or goats, or they were sheep or goats with kids at their side. If they were dry animals, you wouldn't be treating those threes. But now we're talking about treating all the threes, all the adult three animals as well. So you're going to be deworming a lot more of your animals now. So you unfortunately have compromised some of the goals of FAMACHA. Okay, so in that case, you would start checking your animals once a week. And it's really important not to let your, a lot of people, they do FAMACHA, but they do it once a month or once every 2 months. So great, they catch animals and keep them from dying, but almost all their animals need deworming at that time. So they didn't get rid of the pasture contamination. So I don't know how to stress that this is time consuming. You need to do it at least every 2 weeks during the grazing season. Okay. And again, I already mentioned when you would want to treat the threes. If they're young animals, then vulnerable animals, thin animals, or if greater than 10% of the herd or flock is in category 4 or 5. If you're down to one effective drug, you might consider using your less effective drugs on your category 3 animals, or using a single dewormer on them and using 2 dewormers on your 4s and 5, on your animals that are scoring 4 and 5. Don't buy resistant worms. Okay, all your new additions to your herd should be quarantined and aggressively dewormed. And we generally recommend that you deworm them with all 3 dewormer classes or families. And again, don't mix them together. Give them separately on the same day. And then keep your animals in quarantine for at least 2 weeks. Don't put their manure out on your pasture, because that manure is going to have eggs in it that were resistant to both of those or to all 3 of those dewormers. So those are super worms. Instead, compost those worms or put them in your garden or something. And if possible, perform fecal egg counts to confirm that you've gotten rid of most or all of your worms. Okay, so that's 9 o'clock. I'm going to go ahead and continue on with part 3 with what's in our future. And this is going to take about 15 minutes, I believe. And there's 5 different things I'm going to talk about and where these 5 things are at currently. Okay. Okay. So the first of these is a fecal fungus called Dunningtonian flagrans. And it's marketed right now in one form by Premier. You can also order it, order the other form of it as well. And there are about 100 species of nematode-eating fungi, okay? And many of them are found in livestock feces because nature knows that there's lots of eggs in that feces that are gonna hatch out and become worms. And so Dunningtonian it hatches out in that feces along with those worms, and it essentially lassos those worms, those L1 and L2 larvae, and gobbles them up. And there's 2 products that are made by International Animal Health that are approved in the United States. One's BioWorma, and this is the one that you have to contact International Animal Health to order it directly from them. And that one, your mill can order it, or you can order it to be top dressed or incorporated into a feed. And University of Rhode Island is looking at what happens if you mix that into a mineral, into your salt. How effective is it? Can you mix it into 50 pounds of salt and then give it every day after that? Or do you have to mix it in every single day? Is one of the things they're looking at. And then Levomol is the one that's marketed by Premier. And this is a feed supplement. It's a pelleted feed supplement, or it's a feed, I don't know actually if it's pelleted, but it's a feed supplement that you can feed your animals while they're out on pasture, and they can eat it. Okay, so the BioWorma you would need to use for your grass-fed animals, because I think the Levomol has more in it than just alfalfa meal. Okay, and both of these have been approved for organic farms in Australia, and they are seeking approval for organic farms in the United States. So the fungal spores survive passage through the digestive tract. They don't kill the animal while they're in the digestive tract. They remain spores in the digestive tract. Then they germinate, and it's in the feces that they attack. And the livestock has to eat the spores daily, though they're doing testing right now. There are tests going on by the American researchers with the American Consortium right now to see if you could give it every other day or every third day and still have it be as effective. It is very costly. I think it costs about 50 cents a day. So it's almost like going ahead and feeding your animals hay instead of having them out on pasture. There have been some palatability issues with it, though normally after the first few days, your animals start going ahead and eating it. Okay. There was a vaccine that was developed in Australia. It's unlikely to be offered in the United States, in part because they still can't synthesize the antigen for barberpole worm. Instead, what they're having to do is they're having to harvest the antigen by centrifuging worms from lambs and sheep, or from sheep that they've slaughtered in slaughterhouses in Australia, and then they harvest the antigen from those worms. So they get, some of the worms that come into those slaughterhouses are heavily parasitized, and they're able to centrifuge those worms and get that antigen. And they become more effective at how they harvest them so that they can now get enough antigen from one sheep to vaccinate 100 sheep, okay, versus before they used to have to slaughter a lot more sheep. The vaccine's called Barberpole. It did not function that reliably in goats, so it did not get licensed for was unable to get licensed for goats in Australia. And it requires 5 injections. After the first 3 primers, your animals do have some temporary resistance to barberpole worm. And then you need to give 2 more boosters 6 weeks apart. So the idea in Australia was that you would give this to lambs. You wouldn't use this in older animals in mature animals where you hope that they have built up resistance on their, have more resistance than lambs would have. Okay, but again, as I said, right now, it's very doubtful it'll come to the US or Canada. Canada is trying to get it, and is working with some researchers in the US to try, or marketers in the US to see if both the US and Canada can get it. But it's less likely because it's fairly expensive. It's not that effective in goats. And so that's sort of the status on it. And then we have copper oxide wire particles. And you need to keep in mind that the way this works is it only works on worms strongyle worms that are in the true stomach or in the abomasum. So that means that it would only work on barberpole worm or on the brown stomach worm. And unfortunately, it does not work on the brown stomach worm, because we talked about how the brown stomach worm damages the glands of the true stomach. And when it damages those glands, it damages the production of the gastric juices. And this means that the pH of the true stomach does not get as acidic as it should, as the true stomach normally would. And what they found is the copper oxide wire particles dissolve in the true stomach because of those gastric juices, because of the acidity of the true stomach. That's why it doesn't work if these wire particles lodge in the rumen. The rumen's not acidic enough to dissolve them. And so if your animal has a heavy infection of brown stomach worm, the copper oxide wire particles will not dissolve in the true stomach, and you won't be able to get this copper released. So the copper won't work as a supplement for your animal if you're trying to supplement the animal's copper. And it also won't work to kill your barberpole worm because it's not dissolving. And generally what we're hoping for is that it dissolves and it causes lesions on the barberpole worm and makes the worm weaker and more susceptible to the immune system attacking it, and also just more susceptible to dying and not laying a lot of eggs. And we also believe that if your animals are a little deficient in copper, that it gives your animals a little bit of a copper boost, and also helps your animal, helps the immune system function more. Now you cannot, you all are probably aware that sheep are very susceptible to copper poisoning. And so we found that that when this works, it works at very low dosages. And I'll talk about that a little later. Okay, that the dosages are low enough that unless you're giving your sheep other sources of copper, it's usually safe at the very low dosages you want to give it. Okay, and here's Betsy giving some. Okay, so we did studies with about, I don't know, at least 12 farms, maybe 16 farms, looking at copper in the Northeast US. And we found that the copper oxide wire particles didn't work as effectively or abruptly as chemical dewormers, unless you had a lot of resistance already to that chemical dewormer. We found that in farms where it worked in the flock at 0.5 grams per head dosages when it came to lambs. Those dosages were just as effective as 1 gram dosages. On goats, it seemed like possibly that slightly higher dose, that 1 gram dosage might be more effective. But in all the lamb trials, if it was going to work, it was going to work at 0.5 grams. Okay. And they've done studies in the Southeast US where they've given 0.5 gram dosages to lambs a few times over the grazing season without experiencing any toxicity. Do keep in mind that the Cornell Veterinary Diagnostic Lab has done necropsies on lambs that died from copper poisoning at as low as 2 gram dosages. And often when you go to buy it, you can only buy the dosages at 2 grams or higher. And you never want to give a sheep or goat the high dosages that they have for cattle, which I think for calves, it's the 9 gram dose, and you want to avoid doing that. You want to, goats, you can get away usually with that 2 gram dosage. And on adult sheep, they'll sometimes use that 2 gram dosage, but that 0.5 is what you want to use in lambs. Okay. And though it did have a very effective long-term impact at the Extension Learning Farm in St. Lawrence County for over 3 years of testing. Okay, but on our other farms, it had a short-term effect. And in some farms, it was totally ineffective. Okay, and why did the results vary across farms? It could be that the diet of the animals, maybe the true stomach of milk-fed lambs or kids might be more acidic than that of lambs and kids that are getting a lot of grain. The timing of the dosage in relation to the timing of infection, we found that it seemed to work best. And then also the exposure of the worms before. They did some studies in the Southeast US where it seemed like, just like with regular dewormers, animals Barberpole worms could become more and more resistant to the copper. Okay, so if you've been giving your animals a lot of copper already, it may not work as well. In our studies, it seemed to work best when the animals already had some Barberpole worm load when they were first dosed. Okay, rather than, hey, they got their dosage of Barberpole worms 6 weeks later. You know, it also seemed to work best when it was given 2 weeks pre-weaning, but it also did work post-weaning. Okay. And then it also seemed to work best when animals weren't already consuming a large quantity of grain. And it may be that it works well before weaning or before animals are eating a lot of hay or grain because it doesn't accidentally lodge in the rumen, maybe because the animals aren't eating as much grass and grain. Instead, it's able to go directly to the true stomach. We're not sure, okay? We need more controlled studies looking at why we have this effect differ so much from farm to farm. So if you use copper oxide wire particles, be sure to check your animals and see, do a check on them, a fecal egg count on them 14 days later to see if your flock is one of those flocks where it's effective or if your flock is one of those flocks where it's not very effective. Okay. They've also found that grazing forage legumes, Sericea lespedeza in the Southeast US, appeared to really cut down on the barberpole worm. It seemed to reduce the hatching of viable eggs, and it also seemed to inhibit that L3 larva becoming an L4 larva and getting rid of that sheath that's covering its mouth. It has to get rid of that sheath in order to suck blood. But unfortunately, Sericea lespedeza is not winter hardy in the Northeast US, but bird's foot trefoil is. So we did do a bunch of studies with bird's foot trefoil. And the thought is that it's supposed to be the condensed tannins, particularly condensed tannins in the Sericea lespedeza that cause these problems for the barberpole worm. Not all tannins seem to work. They haven't had really good luck with oak or with grape pulp in general. They seem to have promising results with cranberry leaves at University of Rhode Island, but then when they did further studies, it didn't seem to bear it out. In the Southeast US, they've done some studies with brown pine bark where it seemed to help. It's really hard to know. In our studies, and we're still doing some later studies right now, we did find that animals that got the bird's foot trefoil versus conventional pastures appeared to be more resilient as far as to barberpole worm, as far as they seem to have better FAMACHA scores. They seem to gain weight better. There has been some thought that there might be other compounds in bird's foot trefoil besides the condensed tannins that help to boost their immune system. Bird's foot trefoil, because of the high tannins in it, should have more bypass protein. And there's been studies that have seemed to show that rumen bypass protein, a certain a higher percentage than is normally required for the animal, can help to boost the immune system. So we did tend to get better FAMACHA scores. We also found that grass-fed lambs and kids that were growing on lush bird's foot trefoil pastures grew better for the most part than the ones that were grazing control pastures, but we couldn't rule out nutrition. In a lot of these cases, the control pastures didn't have nearly as much crude protein as the bird's foot pastures. The bird's foot pastures were often 18 to 20% crude protein, so really high in protein. And so in these later studies, we were supposed to look at nutrition, but they didn't work out all that well. And we often had that same problem that the control pastures weren't as nutritious. If you are a grass-fed farm, we did find that animals grew really well on the bird's foot trefoil pastures. They often gained a third to up to close to a half a pound of weight gain a day on those pastures. And we also found that if you gave copper wire particles and bird's foot trefoil, they seemed to work together and to be more effective, that they didn't cancel each other out. So whatever's causing one to be effective wasn't necessarily what was causing the other one to be effective. Okay. The last thing I'm going to discuss is a crystal protein, Cry5B, that is made by the soil bacteria Bacillus thuringiensis. And some of you, if you do organic farming or you have a vegetable garden, have used Bacillus thuringiensis before. It's highly effective against other worms such as the tomato hornworm or the corn earworm. Unfortunately, if you give Bacillus thuringiensis to your sheep or goat, it's denatured in the rumen. So it doesn't help to just give it to your sheep or goat. And when they tried to isolate out the cry proteins from the Bacillus thuringiensis and give them to the barberpole worm, egg worms, or give them to the sheep and goats, it was the same thing. It wasn't stable in the ruminant, stable in the ruminant digestive tract. However, they've discovered that if they take those Cry5B crystals and they put them inside dead BT cell walls, that they are able to pass through the rumen, and they reduce the fecal egg counts by 90%. So they seem to really affect the viability of the eggs. They also found that they seem to kill off the adult worms, particularly the adult female worms within the animal. Female worms were killed off about 96%, and males it was a lot less. So about 72% of the adult worms in the animal were killed off. and it seems to be fairly cheap compared to the vaccine. And so there's further testing going on at University of Rhode Island. I think Kentucky is looking at it with worms and horses. And we'll see how it works out. Right now they've got high hopes for it. It probably wouldn't be approved for organic because they're having to use gene therapy to get those, to isolate out those Cry5b crystals and inject them into the dead BT cell walls. And so I thank you all for putting up with this long presentation. And are there any questions? And I'm going to go ahead and stop the share now. Okay. And so if anyone's still alive out there, we'll be happy to have some questions.
They're mostly still there. I think maybe the best thing might be to chat in your questions and then I'll read them. Which there might be one there now. Hang on. Oh, thank you.
Someone had a joke or no? Oh yeah, no, that's Olivia talking about killing her alpaca, the earworm.
Yep. It's we gave you a lot of information. Like I said, it wouldn't hurt to watch the one again, you know, in a week or two when you've digested a little of this to get some of the basics, you know, sort of summarizes what we were talking about in great detail at the Wormex. I will send that link.
And as well as the Wormex one, we've recorded this one, correct? And
yes.
then also, like I said, Cornell does have a website called the Cornell Small Ruminant Parasite website, Parasite Research website. And if you go to that and look on the education page, some of these PowerPoints are there that you can just look at in your own, you know, at your own sweet time. I think the ones we did in 2019 are there. And many of the tables that Betsy's going to be giving you are there as well.
So there's a question here from Daniel that says, can Balbazin be used in pregnant ewes after the first month? After the first trimester, it would be.
And I would talk with your veterinarian about it because when the complaints first came out, it was talking about it anytime during pregnancy. In truth, abortions are very common in the first trimester. So we'll often say it's better to avoid most dewormers in the early trimester. That's why you'll often deworm your sheep and goats right as you're putting the ram or buck in, you'll deworm them right then, because it doesn't take much to make an animal abort in that first 6-week period. But yes, it's supposed to, technically it should be safe after that first 6 weeks, the Balbazin. And I know that, yeah, I don't know if you remember, but when you were having the liver fluke problem, it was suggested that you use Balbazin, and the problem was that some of your animals were still in that.
We're pregnant. Yep.
Yeah, and so that's the trouble. You know, they're infected with deerworm or with the deer fluke. You realize, you know, they're infected, and they're also, you know, that's in the fall, and you're breeding them right then. You know, and you're going, right. Oh my gosh. So that's where the Ivomec Plus would be the other alternative to use at that time, and doesn't have that not being able to use.
Right, which is not labeled for sheep, by the way.
Actually, Daniel's saying that the label says 30 days. And so, you know, both Betsy and I would probably say, follow what the label says, you know. And if you want, talk to your vet as well, you know. But I certainly have used Balbazin in later lactation, later pregnancy, forgetting that an animal was, you know, that I wasn't supposed to use it in pregnant animals, and had them do fine when I've used it in late pregnancy sometimes. So
I also wanted to mention that there's quite a few people on this talk that are from areas that have a longer grazing system and maybe a little different weather pattern. So I think we told you enough so you can make adjustments, but just keep that in mind when you're doing your strategies.
Yeah.
Well, we must have worn them all out.
I think so. And
But
you
I'm
are-
looking forward to seeing some of you over the next few days for the hands-on lab. Be sure you bring a fecal sample if you can get one from your sheep and goats. I think I sent out instructions on that already. And wear clothes that you can wear in the barn since we will be handling animals. Prefer you not wear your barn boots from your barn, although we can disinfect them if they're rubber boots. And I do have plastic boots we can put over. So we will do fecal egg counts. We're going to go over the pre and the post test and talk a little bit about, you know, what you're doing on your farms. And we're going to do FAMACHA in the barn with the animals. So.
And one thing I should add is I will be, Jan Leota and I will be doing a FAMACHA certification workshop in, gosh, where's the next one at? Betsy, can you help me out? It's in Herkimer, the Tuesday after next Tuesday, September 28th. And then we're doing one in Jamestown, so way in Western New York, on October 16th. And I would have a suspicion that you might be able to, if you live in those local areas and you've taken this one but need to do the hands-on part, you may be able to come and do the hands-on part there if you talk to those extension educators directly. I believe Ashley McFarland is hosting the one in Herkimer and Lisa Kapinski is hosting the one in Jamestown.
Yeah, that would be great because there were some people from out of the area that were trying to get the hands-on part. That would be great.
The other thing you can do is if you are on NSIP, National Sheep Improvement Program, or if you raise breeding stock and have sheep or have a meat goat breed, you can talk to NSIP, or you can see if University of Rhode Island was offering free fecal sampling to a limited amount of farms in the Northeast US. If you are on NSIP or considering going on NSIP or sold a lot of breeding stock from your animals. And I think mostly they were doing it to try and push people to become members of NSIP and start proving out their sheep.
Okay.
Thank
Thank you all for
Also-
hanging in there.
Yeah. Okay. Thanks.
And feel free to email us questions, and I will send the link to the recording and all of those things Tot and I talked about, the charts and the web pages and all that good stuff.
And Amy, I do have one thing to say to you. Bob Story has retired, as has Ray Kaplan. And so there's all sorts of evil going on right now. So
okay.
So that's what the holdup is.
Gotcha. Thank you for looking into that. Appreciate it.
And I will know more in the next couple of weeks. Okay.
All right. Sounds good. Thank you, Tatiana.
Okay, folks, have a great night. Time to go have a bowl of ice cream, pet the cat, all that kind of thing. Hopefully you don't have to go back out to the barn. Thank you all for joining us. And you can email us questions. We'd be happy to talk with you about it.
And Betsy, thank you so much for putting this on. And I'm going to head home and go out to my pastures.
Oh, you're going to be moving fence with a headlamp? Is that what you're saying?
No, I'm just going to be doing some feeding and watering out there.
Okay.
Some very young animals out there, as well as needing to check the water.
A little bit before bed goat therapy.
Exactly. Thank you so much for putting this on, Betsy.
Good night, everybody.
And you'll stop the recording, or I will.